we begin, make sure you have a prone support handy. Patients often experience pressure on the face and forehead during prone positioning procedures. So in order to avoid this, our product uses a soft viscoelastic foam. This evenly distributes the pressure across the face and forehead during the procedures. The prone support is generally utilized in conjunction with a torso elevation device. This combination enables the clinician to maintain a neutral spine position and helps reduce pressure on the face and cheekbones. When positioning a patient with nasal tubes on the face pad, ensure careful placement to prevent discomfort. Avoid positioning the tubes over the bony areas of the face, such as the cheekbones, as this may cause discomfort or pain for the patient in a prone position. Our face pad offers plenty of clearance around the eyes, nose and mouth. This improves airway management throughout the procedure. It also reduces claustrophobia, making procedures less stressful.